Hi, this is Tony with StuffSeniorsNeed.com, and I am coming to you today with a video about how to stay safe in the hospital. When you're in the hospital, there's going to be plenty of people coming in and out of your room. That could be doctors, nurses, aides, orderlies, custodians, whatever. And the thing is, as they're coming in and out, in order for you to be safe, in order for you to be comfortable, do not be afraid to ask anyone coming in or out of your room any of the following. First of all, every employee should have their ID on them when they come to the room. Make sure that they do. Obviously, not too many. There aren't too many impersonators out there, but it's still important for you to know exactly who it is you're dealing with. Speak up if someone does not ask, okay, to check your ID. And this is going to be very important. I'm going to be talking a little bit later in the next tip. When they are checking your ID, when they are asking you for your birthday, you might get asked it 15 times a day in there. They're doing it for your own good, and I'm going to get to that in a minute. Ask if the person washed their hands before they touch you. The single most important and the single easiest way for you to avoid getting infection is for both you and anyone involved in a hospital environment, which is a very germ-filled environment. Make sure they're washing their hands before they touch you. This way they are not contaminating you with anything. And if you are told you need a certain test or any procedures done, okay, you should ask why you need them, when it's going to happen, and how long until you're going to get the results. That's mandatory. Now, I was talking about patient identification, and there'll be a lot of times, people are going to be checking your birth date and your name. You might get asked it 15, 20 times a day, and I understand that when you're sick and miserable in the hospital, if you're not feeling well, you don't necessarily want to have someone ask you the same question over and over and over. I get it. But you have to understand that this verification process is an absolutely vital component to any hospital patient safety program. It's designed to make sure they're giving the right treatment to the right person. So you're just going to have to grin and bear it, the 18th time that someone asks you, what's your date of birth? Fighting infections. And I talked about it before, but I'm going to mention it again. The single most important thing that you or your loved ones can do to make sure that to fight infection is to make sure they wash their hands. This goes for the doctors and nurses. Make sure that they wash their hands too, and have absolutely no qualms about talking to them if you don't think if they did. Okay? This is when you, your friends, and your family should be doing it. Okay? If you touch any of the surfaces in the hospital, the furniture, the chairs, the bed rails, things like that, before you eat and after using the restroom, okay, either wash with soap and water or an alcohol-based cleaner. Okay? Every time, before and after they touch you. Healthcare providers understand and are actually taught how to wash their hands. I know it might seem silly because this is something we've all been doing since we're 18 months old, but yes, they are taught the proper way to wash their hands. You and your family should not be afraid or embarrassed to speak up and ask people to wash their hands around you. And they should not be embarrassed or offended in any way to do so if you ask. Next thing, you have to understand and know what your medications are. Okay, when you're in a hospital environment, you could be getting multiple medications from multiple doctors. So just as a checklist, know what the name of the medication is. Know what its generic name is. Okay? Understand why you're taking the medicine. What dose are you taking? How often? How long do you have to take it? When does the medicine start to work? What type of side effects can you expect? Can you take this medicine while taking the other medications or any dietary supplements? Are there any foods or drinks that you should avoid while taking this medication? This is to prevent cross-medication issues, and it's vital that you ask. Should you take it with food? Should you take the medicine at meals? Should you take it between meals? Okay, does it need to be taken on an empty stomach with food, with a glass of water? And what do you do if you forget to take the medication and you miss a dose? These are all questions you're going to need to ask for each medication you're taking to stay safe. Now, preventing medical errors. Bottom line is, you need to let your doctors know what type of medications you're taking. Now, this is not only prescription, okay? I'm talking over the counter, I'm talking nutritional supplements, I'm talking natural remedies, and you know what? You gotta let them know if you're using any recreational drugs. I understand that what you're using might be illegal, okay? But just disclose it to the doctors. They're not gonna be running to the cops, okay? So if you're smoking weed, if you're taking anything else, okay, this could react violently with the prescription medications you're taking. So they're going to find out one way or another. Okay, it can either be by you telling them, or it can be from the side effects of the medication you're taking. So just do yourself a favor. The best thing you can do is just fully disclose everything you're taking. Okay, be sure all your doctors know what your allergies are. Okay, and this is to medications, latex, food, anesthesia, whatever. Okay, it is the patient who plays a key role in avoiding these medication errors. And make sure before anyone does anything with you, make sure that that person sees your ID, or they have double checked with your name and your date of birth in order to make sure you're getting the right medications. Now, slips and falls in the hospital. They do happen a lot because people are weak, unsteady on their feet due to being sick, due to the medical procedure, due to feeling dizzy, due to side effects from the medications. So help the hospital keep you safe, okay, by just following a couple of quick and simple guidelines. Don't get out of bed by yourself. Sounds simple enough, but yes, make sure to stay in bed. Hospital beds are higher and narrower than your bed at home. It's easier to fall getting in and out. That's what the call button's for. Keep items that you will be using, water, tissues, TV remote, within easy reach. Do not walk in bare feet. You use non-skid socks and slippers. Those are the ones the hospital provides for. Okay, make sure your pajama and robe don't drag on the floor. Use handrails and grab bars. Be sure that the wheelchair is locked. Okay, and if you see a spill on the floor, make sure to report it. All of these tips are very important to keeping yourself and your family safe while you're in the hospital. So I hope that some of the tips and ideas helped. This is Tony with Stuff Seniors Need, and I'll see you next time. Take care.